Well, welcome everybody and good afternoon to this Sapphire Institute webinar. My name is Dr Elisabeth Philipps and I hope you've been able to join us for our previous webinars that we've been running in this In Conversation series with. So you'll know that we're just going to spend a moment or two, around about a minute, just waiting for everybody to come on board and join us on today's webinar. I'm just going to give a couple of housekeeping duties, just around the webinar to remind you about asking questions. So I will be introducing Dr Wendy Holden just in a few moments time, just before we get the webinar officially kicked off. So yes, just to remind everybody that this is actually the final in this particular In Conversation series, our final webinar with Dr Wendy Holden. We're going to be talking about prescribing medicinal cannabis, but right from the outreach, as we do with all of the Sapphire Institute webinars, I just want to remind you of this disclaimer that we are not able to discuss personal cases today on this webinar. So we always recommend that you need to go and see your general practitioner, your medical professional, if you want individual advice around conditions. But we will be talking generally today around prescribing medicinal cannabis and looking at sort of different pain areas and pain management. Also, there's a chance to ask lots of questions. So please feel free to put your questions either in the chat box where everybody can see them, or you can put them in the Q&A box as well. And I'll be able to feed those into the conversation that we're having today. So please feel free, ask away, and we'll hopefully be able to get your questions, general questions around the area answered. We are recording today's webinar, so there is the full series of this In Conversation in Sapphire Institute series available. We've been talking to patients originally, or in our initial webinar. We've also spoken to Leon Barron, the GP. We talked to Michael Sodergren around the research side of medicinal cannabis. We also had Professor Saoirse O'Sullivan last time talking about CBD and the research. So we've got a really fantastic free education resource sat within the Sapphire Institute now. So I can see we're around about a minute or two in, so hopefully lots of people have joined us now. So again, just to remind you, as a disclaimer in today's webinar, myself and certainly Dr Wendy Holden are not able to discuss any of the sort of personal, excuse me, conditions or personal questions that you might have around relating medicinal cannabis to your conditions. Please do go and see your medical practitioner in that area. So without further ado, I would just like to welcome everybody again to today's final Sapphire Institute webinar. We're talking with Dr Wendy Holden, and she is a rheumatologist, but also a pain management specialist. So we're really delighted to have you on board with us today, Wendy, because I know you're a wealth of knowledge, and we're going to have a really interesting discussion around medicinal cannabis and prescribing and sort of patient access to medicinal cannabis as well. So Wendy, I would really like for you to give an introduction to yourself, maybe a bit about what you're doing now, before we start our discussion. So over to you, Wendy.
Thanks very much, Elisabeth. I'm really excited to be invited. Thank you. So I am a consultant rheumatologist based in Hampshire. And I've done lots of other things as well. So I was an osteopath before I became a doctor. I've done extra training in pain management, and I've done acupuncture and all sorts of things like that as well. So I first became interested in cannabis as a medicine when I was actually working in neurorehabilitation as a registrar, and I was involved in a trial of what became Sativex for patients who had MS, and I personally administered some Sativex to a patient on one of these trials and saw the absolutely remarkable effects on this young chap who had terrible disabling MS. And so I sort of filed that at the back of my mind. And then I went on to train in rheumatology and started to see lots of patients with chronic pain, especially fibromyalgia and inflammatory arthritis. And also I started to see some patients who had MS as well as inflammatory arthritis. The two are both autoimmune conditions. And some of these patients had been prescribed Sativex for their MS and said to me that their arthritis was better or their pain was better. And so then I started to ask a lot of my pain patients what they were actually doing for their pain. And I started specifically asking them about had they ever tried cannabis for their pain. And none of them had ever really told me about this before. And their eyes lit up and said, well, yes, I have actually. to cannabis, and were getting significant benefits from it. And then last year, about just over a year ago, and I saw an advert for doctors wanted at Sapphire Clinics. So I thought I'll just see what that's about, and I got really interested in it, and got offered a job. And I started very slowly, and I loved it so much that I'm now doing 3 days a week with Sapphire. So I'm seeing all sorts of patients now, mainly chronic pain, but also the patients with inflammatory arthritis, of course, because that's my area of expertise. So it's a steep learning curve, but I'm seeing hundreds of patients now, so starting to really see the results.
Wonderful. Well, that's, I mean, a fantastic story. It's great to hear how you've arrived sort of full time, if you like, in the medicinal cannabis world, and one that I know we were discussing and how relevant it is, especially in the pain management area. Mm-hmm. And I think, you've raised several points which I'd love to cover, a little bit later on. You were talking about, self-medication with cannabis. But I wonder if we could maybe start just looking at, some of the patient challenges, because you mentioned you see hundreds of patients now and around the sort of chronic pain. What are some of the sort of patient challenges maybe that they're coming to you with managing chronic pain?
So pain is not just pain, really. It obviously is just pain, but it comes with lots of other things as well. People who have chronic pain live with anxiety about the pain. They get low because of the pain. They can't sleep because of the pain. They get frustrated. Every aspect of their life can be impacted by this pain. Their quality of life drops. They may have employment problems, all sorts of things. It just truly affects every aspect of everybody's life. And you may start off with a single pain, say pain in a knee if you've had an injury. And before you know it, you might have had surgery. The surgery might have worked, but your sleep quality has been affected by the pain. You've been put on lots of different medications for the pain that have not necessarily worked. You may struggle with side effects because of those medications. And before you know it, another pain pops up somewhere else. And then people, unfortunately, can sometimes get into this downward spiral of one pain leading to another pain, increasing disability, less exercise, bad sleep, and it can become a spiral for some people. And then before they know it, they've lost their jobs, they become low, they become depressed, and have got themselves in a right old pickle just because one pain started somewhere. So it's really, really multi-dimensional, this whole concept of pain.
Mm-hmm. No, absolutely. I mean, you mentioned that pain cycle as well around, sort of the aspects of pain and mental health and sleep. And it's almost at what point in that cycle do you sort of try and break, isn't it? I mean, obviously we're addressing the pain, but, do you go in at supporting a sleep side? And of course, there was the paper that was released last year from the UK Medicinal Cannabis or Medical Cannabis Registry around sort of specifically looking at medicinal cannabis and quality of life, because I think we're agreed that actually that's almost more relevant and more important to be recording outcomes. So I wonder if you want to sort of comment around that.
That is absolutely right, because obviously pain is one thing, and you may well be able to get on top of pain slightly, but the quality of life is the most important thing to us as humans, really, isn't it? What we do with our family and our friends, and how we feel about our whole lives. So you're right. So Sapphire published some research on about nearly 200 patients last year in December, looking at just this very issue. So they followed up about 200 patients for up to 6 months to see what benefits medical cannabis had on their lives. These are all patients with chronic pain. And they found that there had been significant benefits in many areas, including pain, sleep, mood, anxiety, sleep quality in particular, most importantly, really quality of life measures. And in addition, people had managed to significantly reduce the amount of opioids that they'd been taking, which is another issue with chronic pain. The polypharmacy, the vast numbers of conventional medicines that many people take, and often when you ask somebody what's really important to you, they say, actually, I really want to get off these opioids. I just want to come off some of these medications. So things like that are not really things that are conventionally captured in the course of a consultation. So quality of life things very important for individuals.
Absolutely, and you're quite right. I mean, you mentioned earlier about the side effects of a lot of conventional pain medications as well, which can really be very severe. I work a lot in sort of professional sport, and athletes there are, certainly finding that opiate use can be a real issue. So, but I mean, sort of going back to your, sort of days in rheumatology, sort of pre the medicinal cannabis prescribing. You also sort of mentioned almost the paucity of conventional pain medication. We know there's a lot, but how did you find, what was available conventionally to prescribe for different conditions, for example, or for different types of pain?
So by the time patients come to secondary care, they will often have been tried on lots of conventional medicines by their GP, which probably haven't worked. And then these days, as opioids are not really recommended for chronic pain, the number of products that we have available that are effective are so restricted. Obviously, we have things like anti-inflammatories and paracetamol and perhaps a little bit of codeine that help some people, but often they're not well tolerated. People have side effects. Plus, understandably, people don't want to take 8 tablets a day or 3 lots of different painkillers. There are obviously slightly higher up medications like things like pregabalin and amitriptyline and gabapentin, but again, all of these come with their own special problems, side effects, intolerances, and many people just don't like taking these pills regularly because it's not a good solution. One thing leads to another, and you may well take an anti-inflammatory for your pain, end up having to take a stomach protector to deal with the side effects of the anti-inflammatory. Your blood pressure goes up, you end up on another pill to manage your blood pressure, and before you know it, you end up on 5 or 6 different pills that don't seem to be really doing much and probably potentially causing more harm than good. So that the amount that, in terms of chronic pain management, the conventional options are very limited, I think. It's frustrating, I would say.
Well, it must be, and I think you as a clinician saying it's frustrating. It's of course we know it's frustrating for the patient, and it's a real predicament. But it's the same for the clinician because you want to be able to do the best for your patients.
Totally, totally. You're going to medicine wanting to help people, and then you say to people, "Have you tried this pill? Yeah, I tried that. Doesn't work. Have you tried this one? Have you tried that one? Tried everything. Doesn't work." And you think, "Oh dear, what am I going to do now?" Yeah. Exactly. Frustration is the word.
No, very much so. And somebody's made a very relevant comment as well, because of course the pain and the pain cycle negatively impacts immediate family and friends as well. It's got that ripple effect. It's not just the quality of life of the patient, of the individual.
That is totally right. And then my experience of that is that people don't want to discuss these things with a family because they literally get sick and tired of being sick and tired, and they don't want to feel like a burden, so they keep it quiet, and then it festers inside. Right.
Yeah. Yes, absolutely. And as we know, anger and sort of frustration, when that manifests, is only really a negative stress within the body as well. So it's all additive. And I mean, we had a really interesting discussion with Caroline and Andy, who are patients at Sapphire Clinic, and both on medicinal cannabis for different reasons. Andy is on medicinal cannabis around fibromyalgia type pain. Caroline's on her medication for ADHD. But again, refer people back to the Sapphire Institute webinar library so you can have a look at their discussions. But I wonder, from a prescriber's point of view, then you sort of said last year, you sort of moved much more into the medicinal cannabis side now, three days a week. What would be sort of a patient journey then, for a patient that's tried a lot of pain medications that isn't really finding it's working for them? What would you sort of say would be the patient journey from a prescriber's point of view?
Okay, so well, as far as the patient is concerned, patients can refer themselves to Sapphire, or they can ask their GP to refer them, or a specialist to refer them. But it's a pretty straightforward process. Just look on the website; it's quite easy, so you can refer yourself. We will need some additional information about your medical history. Obviously, we have to make sure it's safe for you. So we need some advice from some information from your GP, who can provide a summary of the recent things that have happened to you. It's really helpful to have information if you've had previous scans or seen some specialists, to know exactly what your diagnosis is, and it's really useful to know what medications you've tried already. So Obviously, we would not see people who have not got a diagnosis, and we would not see people who have not tried any conventional pain management strategies. So, you know, because these simple things might work. So, medical cannabis is not an option as the first line of treatment for any condition, of course. So, what happens then is once the paperwork has gone in, and once we've seen the referral, one of our doctors will have a look at that referral and then agree that one of the consultants can see you, and then you will be allocated a consultant to see you, one of our pain management specialists. All of us are pain specialists, all of us are consultants, so we're all very experienced at dealing with patients with chronic pain. And then what will happen is you'll be given an appointment via Zoom, which is a lot easier. Well, you've all managed to do it today, so so it's a lot easier than it sounds. Lots of people are obviously slightly worried about technology, but it works well for everyone. So the first consultation, nothing at all to be nervous about. So we would just go through your history pretty gently, look at the medication that you've tried, see if you've got any other medical conditions. To make sure that cannabis is safe for you, which it is for the vast majority of people that we see. There's a few things that we need to make sure that are safe, certain medications that we would be careful with medical cannabis, and certain conditions that we would be careful with medical cannabis as well. But once we've gone through the history, we will then talk about whether or not you've tried street cannabis before. Sometimes it's quite helpful if people have tried street cannabis, because then we know if it's been helpful. So I think about half the people that we see will have been self-medicating already with street cannabis, so have some views on the subject. Lots of people that we see are complete experts on that subject. You know, they know all about the different strains, and they know a lot about medical cannabis. And then other people will not know anything at all. So we'll just tailor the education to the individual and talk through the different products that we have available and the different ways of delivering medical cannabis. And then we just speak about side effects, and the procedure. And then once we've done all that, then we meet every week as a team. All the consultants meet up as a team more than once a week. We meet, and then we discuss all the patients that we've seen, and then the whole team agree or not whether or not the prescribing cannabis is a good idea. And then the prescriptions are made up, and then the cannabis products are delivered direct to the patient's house, and then off they go. We've got a great team of admin people and pharmacists in the background who can support with help, advice on side effects. And then we would normally check in around 3 to 4 weeks to see how things are going, and adjust the doses, adjust the prescriptions. And then once we've got the exact prescription or recipe right for that patient, then patients then would have a follow-up about every 3 months time after that. So it's pretty straightforward.
Brilliant. That's great, actually. Thank you so much for clarifying that, because I know that there's a lot of questions that can come up around these areas. And again, you know, you've raised several parts, and we've got some questions coming in about you know, looking at different strains and things. So I think first of all, you mentioned very much that it's important that you know, it's not first line therapy. You know, people will have tried other medications first, and that also, of course, you know, you mentioned that other medications may work, you know, in certain cases. You know, medicinal cannabis isn't the answer for everybody. But it's certainly a route to try, you know, once other medications, you know, haven't been maybe as successful as needed. But you mentioned around the street cannabis side, and that it's actually quite important that people do put down on the form that they are sort of open around, you know, having tried in the past, or whether they're currently consuming. What do you sort of feel? I mean, do you feel there's still a sort of a stigma or a taboo around people wanting to or not wanting to say about street cannabis?
Yes, this whole thing is quite interesting. Yes, I see lots of people who are who use the word sort of embarrassed or ashamed, or those kind of words, because there's this perception that it's not medical cannabis. There's obviously street cannabis is an illegal drug, but lots of people have been using street cannabis and keeping it a secret from their families, for example, or their children, and doing it in secret, and they feel a shame associated with it. And obviously, because it is illegal, you cannot be using cannabis on the streets openly for your pain. So this confines many people to their homes. And lots of people, when they first speak to me, they say, oh, I wasn't sure if I should tell you that I've tried cannabis. And I said, that's absolutely fine. So many of our patients have tried, of course, and that's natural, isn't it, to try and find something that will help you. And it's good that we can help these patients to legitimize that. That's very important for many people. When I start talking about people to people about this shame, many people are tearful when they get very emotional when we can agree to prescribe for them, because then it makes it legitimizes this for them.
Yeah, absolutely. Well, you're removing barriers to access as well, because I think as we know that there's other issues around accessing street cannabis as well, not just in terms of the quality of the product and what's in the product and the ratios of phytocannabinoids, but also just the whole potential scene as well around it. So by removing the barriers to access to making medicinal cannabis more accessible, is going to be helpful to patients, isn't it? So,
that is totally right. And people like you, imagine people like you or I trying to go and purchase street cannabis, and people get themselves into some dangerous situations potentially, which is obviously unsatisfactory. No one knows what you're getting when you're buying street cannabis, and also the cost. Obviously, it's not unusual for us to see people who are spending £600 or £1,000 a month on street cannabis to manage their pain. Just to manage their pain. I'm not talking about people who are using it for other reasons. These are people who are just using it for pain.
No, absolutely. And yes, actually we hadn't mentioned cost there, but that's definitely an issue as well. So sort of talking, I mean, I mentioned there, we don't know in street cannabis, which is one of the real issues around it. We don't know what's in the product, in terms of quality, in terms of ratios. We've had a question around shedding some light around different strains of cannabis for chronic inflammation, for pain, the sort of the proportions of CBD, THC.
Yeah.
I mean, I just wonder, from your prescribing sort of point of view, is there, what would maybe be what would you reach for first, say?
So we have sort of it's a very complex issue, this, and as you know, there are thousands of different strains of cannabis plant, and each of them have their own special combination of phytocannabinoids and terpenes. So even with the prescribed medical cannabis, there is not necessarily a detailed breakdown on every single phytocannabinoid that is in that mixture. But broadly speaking, as you know, strains are divided into sativa predominant or indica predominant or hybrids, which is a bit of both. But even amongst those divisions, there will be lots of other phytocannabinoids in both of those products. So people react differently to different strains. Some people find that indica strains to be more sedating. Some people find sativa strains to be more uplifting, if you like, but other people find it's the other way around for them. So that, I think that's one of the interesting things about this whole business of cannabis medicine, is that people react in different ways to different strains. So we have a very broad range of products available, different strains, different products as well to try. So it's a question. I mean, one of the main principles that we use is just to start very low with the doses, because some people respond very well to very, very low doses. And obviously you don't want to take medicine that you don't need. So we start very slowly and go up very gradually to increase the dose to avoid side effects as well. And of course, to minimize the cost.
Absolutely. Well, and actually start low, go slow is kind of the
mantra.
Is supporting the endocannabinoid system, where a large part of the phytocannabinoids and the terpenes are working as well. So yes, very very important. So that's interesting, actually. So when an individual is accepted, is working with you within the clinic, so would you, with your knowledge that you're gaining around medicinal cannabis, would you have a sort of a specific, an indica or sativa strain with somebody coming in with a specific condition? Do you know sort of a bit more about matching, or is it?
No, not necessarily to start with. I mean, some people who are experienced with street cannabis would say, I definitely prefer certain strains, and so we would obviously work with them. But for beginners, we would start with something that is likely to work, and at a low dose. We haven't spoken about CBD at all in that mix at the moment, but that's vital as well.
Yeah, that's interesting, isn't it? Yes, we were talking earlier about the CBD THC ratio. So I wonder what your sort of take on and experiences in that then about the
so the CBD is obviously that's a phytocannabinoid as well as the THC, the two main phytocannabinoids being CBD and THC. And for pain management, CBD I think is vital in that mix as well. So lots of people will have tried over-the-counter CBD. For some, it might have worked. For some, it might not have worked. But it's really important to understand that what you buy over-the-counter may not be the same as what it says on the label. So because of the way that CBD is marketed, obviously it's legal to buy CBD, but there is no quality control in what you buy over the counter. So there was a study actually done of looking at all the different analyzing all the different various CBD products that were available on the market, and it was found that 60% of them didn't have in the bottle what it said on the label. So some had no CBD at all, and some in fact contained THC, which is illegal to buy over the counter. So you never know what you're getting with over-the-counter CBD, even if you buy it online, and it could well have heavy metals or pesticides or all sorts of other things in it. Whereas the prescribed CBD is drug grade CBD, and you know exactly what you're getting with this. So we would encourage people. Many people have tried over-the-counter CBD. Some people say it works a bit for them, which is fine, but many people say it doesn't work, and they feel slightly reluctant sometimes to try prescribed CBD. And yet when we persuade them to do that, many people say, oh, yeah, I can see the difference now. This is quite different to what I was buying previously.
Yeah, absolutely. No, I mean, in terms of when we say over the counter, we mean CBD as food supplements, and this is
exactly
that's it. So Professor Saoirse O'Sullivan, we were sort of discussing this as well. So, you know, please feel free, everyone watching, to go back and have a look at the Sapphire Institute library there, webinar library. And yeah, we were saying, you know, and in my clinical experience as well, you know, a reputable brand of food supplement CBD that has what it says on the label, you know, used correctly, you know, can for many people have a good benefit. But then the other thing that we were talking about, Saoirse and myself, was also the levels that you were taking, because in food supplements, you know, you're taking 5 milligrams, 10 milligrams, 15 milligrams of CBD daily, whereas actually, you know, in medicinally prescribed products, you know, we know about the safety, we know about the quality, you know, the range can be much higher as well.
Absolutely. Absolutely
required. So that's another reason for, you know, going to see a prescriber at a clinic, so that you get the right levels. So actually we've had a couple of questions. So I'll take the one around the products first, and then we'll talk about, you know, the how they work, how long they take to work. But the part of the question was around types of medicinal cannabis products as well. So obviously the vapes, the tinctures, you know, what's your sort of experience, and is there
so there are lots and lots of different preparations. So the two main ones that we use are the oils, CBD and THC oil, which is pretty straightforward. These oils go under the tongue and are pretty simple. They don't taste very nice, so that's a bit of a barrier for some people. So for people who have difficulties keeping the oils under the tongue, we have capsules. There's also lozenges. There's also topical. I couldn't really speak much about that because that's not my area of expertise. So there's rub-on cannabis-based medicines as well. And then there's the actual dried cannabis, the dried cannabis flower that we can prescribe as well. And there are many different types of the flower that we can prescribe to for dry vaping, which is not the same as smoking. Vaping is totally different to smoking. And it is not through oil vaping either. It's a special it's a dry vaping device that people need to get hold of to use the dried cannabis for.
So is this something, you know, when you're seeing a patient for the first time, that they could express a preference around, you know, the style of medication they would like to take?
Yeah, definitely. In general, in terms of pain management, the two routes really, basically the oral route of the oils and the inhaled route work in a different way. So the inhaled cannabis, because the vapor goes into the lungs, it's absorbed very, very quickly into the bloodstream. So it works very fast. Within a minute or so, you can expect some effects. but just as it comes on quickly, it also wears off fairly quickly within an hour or so. So it's good for emergencies, terrible pain, acute muscle spasm, and things like anxiety and panic attacks when people feel as though they can't cope. So it's good for emergencies. The oils work in a different way because they're more slowly absorbed. So they tend to give a better level of CBD and THC in the blood for a longer period. So they give more sustained pain relief. So they're better for background pain. So for many people, a combination of the two things is a good thing. Now, not some people, of course, don't want to try vaped cannabis, which is fine, and they would just start with the oils. And other people feel strongly that they're managing their pain quite well, apart from certain emergencies, and so they would prefer just to have the dried cannabis for vaping. But whatever they choose, we would really encourage them to try and have some CBD in the mix, because we know that CBD and THC work better together than either of those two things apart.
Right. Yeah, no, that's interesting and to say. And would you say that's for, many pain type conditions as well?
Yeah.
Because we've not really sort of covered areas, but everything from, the sort of fibromyalgia type aspects of pain through to
yes, definitely. And I think it also depends to some extent on the patient's other comorbidities as well. So for example, people that are very anxious often find that a bit more CBD is helpful for them. People who have a lot of muscle spasm find that a bit more THC is helpful for them. So this is very much sort of individualized medicine and personalized for the person with their particular problems.
It's interesting. I mean, you say around spasms. I was working with a patient around muscular issues, but they were taking a sort of a THC CBD blend, and they were sort of orally ingesting, and they were finding that it also then helped their anxiety induced IBS
Absolutely.
as well. So it not only helped the muscle spasms within their system, but it also actually helped their gut.
Helps on the inside.
Exactly
Right.
down, because they were finding that every morning in particular they had a real issue with IBS, and couldn't do a school run because they weren't sure where the next toilet was. So actually it's those sort of side effects, positive side effects.
Exactly
as well. So but of course that's then going to depend on the route that you're ingesting as well, that you're taking. So interesting. So we've had a question here as well about on average it's difficult to say, but I mean how long would a patient need to be taking medicinal cannabis before they could start reducing maybe conventional medicine, pain medication?
That's a really interesting one. So I sometimes see people at a month. We see people at a month follow-up, and I sometimes hear people say, well, actually I don't think I'm any better. And then I say, well, how are you getting on with your conventional medicine? And they say, well, actually I've stopped it all. So so then we explore that in a bit more detail, shall we say. So it depends. So sometimes at a month follow-up, people have already started to reduce some of their conventional medicine, and it surprises people. They say, do you know what, I forgot to take my morphine yesterday, or I didn't take my tramadol. And obviously it means that they've not had that pain, so they haven't reached for that pain bottle. So often by a month you can see that people are starting to reduce some of their conventional drugs. Which is great, amazing.
Yes, yeah, gosh, absolutely. I know we were talking earlier about again, as a prescriber, as a clinician, we want to be able to do the best for people. So to see that, but it's also interesting. I think something that you mentioned as well earlier on is that again we're looking at different aspects here, not just reduction in pain, but the quality of life side. And of course, that's where gathering the real world evidence, which can be done through various registries and with Sapphire as well and other clinics. That's so important. But I guess also being able to spend a bit more time with patients as well, that you're able to in a medicinal cannabis consultation versus
definitely. And I also think that when their quality of life is going to be improved, you're more likely to say to them, well, actually, what's important to you at the initial consultation. And then when you check in with them, you can say, well, what's happening? And they say, well, actually, I went to a party with my family last week, or I've walked with my dog on the beach for the first time. And so you hear these real gems that people have, that are really important to people that you can't necessarily capture in a questionnaire. And you certainly wouldn't be asking those questions in the NHS, because you're not going to get the right answer next time, because it's probably not going to have happened.
Yeah. Yeah, absolutely. And the time issue. And hopefully that's answered one of the questions that's come into the Q&A, where they said, have there been cases where medical cannabis treatment has allowed a return to activities that pain has stopped? So
absolutely,
you know,
all of our consultants are in a WhatsApp group, and I would say almost, if not every week, every other week, somebody is saying, I've just heard this fantastic story, somebody's gone back to work. So we hear great stories all the time. I mean, obviously that is not the case for everybody. We can't, medical cannabis does not work for everybody, but we have heard some remarkable stories.
Yeah, no, and absolutely. And that's why it's so important that we're able to provide, you know, through the Sapphire Institute, you know, this free education, so that at least people have, you know, the understanding as to how they can access it and try it, to see if it's going to work for them. So we've had an interesting question as well, actually, just around advice for medical students. Now, it's just a general question saying, please share some advice for medical students, but I wonder if that maybe encompasses, you know, how they can find out more about training in medicinal cannabis. You know, what's your
that is
sort of
a great
thoughts
question.
that?
I don't know how much medical cannabis is covered in the medical school curriculums these days, but in my days there was zero, none.
No, the endocannabinoid system still isn't covered. I still have an issue.
Exactly. So what I would say is that the Sapphire Institute provide a lot of learning for medical professionals free. So sign up and look at the webinar. So there's lots of information about the endocannabinoid system and the science behind it, masses of research papers. There's a whole world out there that I was not aware of this cannabinoid research going on in conferences, and especially driven by the North American and Canadian market, where in many places it's medical cannabis is completely legal and widely available. So there's a whole world out there to explore. So a very, very interesting field to get into. So I'd recommend it for anyone that's interested.
Yeah,
forget conventional medicine, do something different.
Well, there's definitely a wide sphere out there. I think you've demonstrated that, Wendy, with your background as well in acupuncture and osteopathy and osteopathy and covering all bases. So I think, you know, my advice is, you know, keep your eyes wide open as a medical student. You know, just be open to
absolutely open to it. But yeah, because like we were saying earlier, that as a doctor you just want to fix people, and sometimes you just can't. But this for me, this has been fantastic.
It is, and it's another tool in your toolkit. I think that's the thing.
Definitely.
You know, it gives another area. So, and I would also recommend as well, you know, as Wendy said, you know, Sapphire Institute has lots of free, you know, sort of clinician and patient education where you can just sign up on the website. But also do have a look at Leon Barron's In Conversation webinar that I did back in November with Leon, who's a GP, and he runs groups around sort of, you know, clinicians accessing medicinal cannabis information as well. So do take a look at that webinar. So we've had a really interesting question, actually, going back to actual sort of, you know, taking medicinal cannabis as a patient. And this person has said that actually higher dose sometimes or enhances the pain that they're experiencing. You know, have you sort of seen, you know, sort of maybe extraordinary things happening or changes that you hadn't anticipated through?
Yes, the endocannabinoid system is not well understood. It's extremely complex. It involves almost all cells in the body and tissues in the body, and it is very, very complex. And I have certainly heard of patients. I haven't actually heard it through patients that I've prescribed for, but people who are using large amounts of street cannabis have said to me that sometimes their pain is worse. Certain strains have sometimes made their pain worse, and the view is that probably relates to the fact that their street cannabis generally contains a lot of THC, high levels of THC, and not CBD to balance that you need the two to balance. So CBD can help reduce the side effects of THC and vice versa. So that's why CBD is so important. But that is a kind of paradoxical response. So in general, if people get an exacerbation of their pain, reducing the THC levels can definitely help.
Absolutely, yes. Now I've certainly heard anecdotally from patients around CBD taking the edge off the THC effects. So yeah, and again, actually, we're obviously talking about pain, you know, relatively generally today, but we've acknowledged the very complex nature. And you know, we've talked about chronic pain, you know, people in pain, every day, every minute of the day, but there's also cyclical pain. And of course we're in the month of March, we're in endometriosis sort of awareness month as well, and I wonder around sort of more cyclical pain and experiences, and what's your sort of experience as a prescriber around endometriosis and medicinal cannabis?
Yeah, absolutely. So obviously I'm not a gynecologist, and when I came to Sapphire I was not at all familiar with endometriosis. However, now I am very familiar with the difficulties that women have with endometriosis, and I believe the research on this says that it takes about 7 years or even more for women to get this diagnosis, and many women struggle with terrible pain. Somebody told me yesterday that 2 weeks per month she works, but for 2 weeks a month she can't work, and her boyfriend has to help get her dressed and get her out of the bath because of the severity of this pain that she has. And for many of these women, many of whom are in their 20s and 30s, there are very limited options. They may well have gone through various hormonal treatments, various coils. They may well have had multiple surgeries, which can sometimes compound the difficulties, because then people get more problems with adhesions and abdominal pain. And so they end up in their 20s or 30s really with very little options of places to go, with this terrible 10 out of 10 pain for several days per month. So my experience of prescribing, anecdotally, none of this has been published as yet, is that medical cannabis can make a significant difference to the quality of people's lives during this time. So we are awaiting to collect enough patients so that we can publish some of the data that we've got. But I've certainly had some promising early.
Wonderful.
Yeah.
Yes, yeah, and I think, as you say, that's really young women, young people as well, that this is affecting. Sometimes when people think of chronic pain, they're thinking more as you move through advanced years, but this is very real at a very young age as well. So I mean, you talked about sort of collecting data as well. How as a prescriber do you collect the data, and what's done?
So there are a clever team of backstreet, I nearly said, but backroom experts who have attached to the website got masses of different questionnaires related to pain. So if you become a patient with Sapphire, you'll be encouraged to fill in these questionnaires when you start and at regular intervals through your journey, so that we can collect this information and really, really importantly, publish this information so that we can get this real world evidence that these products can help people. So it's really important to get that data.
Yes, yeah, absolutely. And we sort of talked a bit in our last Sapphire Institute webinar as well about sort of trying to get the real world evidence through as part of NICE and MHRA recognised, so that we're not just relying on RCTs or randomised control trials. So
exactly. I mean, trials are expensive to run, and probably not feasible at the moment. So yeah.
No, and
real
also,
world data is much more important.
Well, exactly. And as we said, you're then able to pick up on the quality of life, which is actually the biggest patient impact. So.
Exactly. And really, after all, when you're dealing with somebody, you're not really interested in a clinical trial, because you've got that person in front of you. You're interested in that person, and if you can help them, that's really all that matters.
Yes, yeah, absolutely. So we've got a question here. Again, I wonder if you could just go through about referring patients to yourself or to Sapphire. So just that initial stage, how people can access.
Yeah, it's really straightforward. Just through the website. Really straightforward way through the website, and just send in a letter. Everything's done electronically. It's all very easy.
Brilliant. Yeah, absolutely. So yeah, you'll find that on the Sapphire Clinic website, but then also, as I say, do have a look at the Sapphire Institute as well, which is where all the free education is as well. So I think, I mean, if there's anything else you'd like to add, Wendy, do you think we've sort of covered all of the bases for prescribing?
I hope so.
Yes.
Yeah.
No, absolutely. And we've had some great questions and so a really lovely feedback as well that people have put into the chat box as well, and saying how much that Sapphire Medical Cannabis has helped them. As we say, there is the disclaimer here, please go and see your medical practitioner around individual cases, or of course, do log on to the Sapphire Clinic website for referral, self-referral. And just one final form, you said about Sapphire enjoying sort of, forms to collect real world data. We wonder if you could, all of you that have attended today's webinar, just complete the short feedback form. There is a link in the chat box. I think a link might be sent in an email as well, but just to help us to really refine the content that we can bring to you through the Sapphire Institute as well. So thank you for your feedback, everybody. And of course, a huge thank you, Wendy, for closing our first inaugural session of In Conversation series with Sapphire Institute. It's been fantastic talking to you today.
Thanks, you too.
Yeah, wonderful. And just wishing you all a really great rest of your day. And we look forward to welcoming you all on a Sapphire Institute education series very soon. Thanks very much, everyone. Bye.